Good morning friends. Stiffness in fingers is very common after any kind of traumatic event to the hand or as a result of any surgical intervention in the hand. Today we will be talking about stiffness in the fingers. Now the stiffness of the fingers can arise from two joints. First is the metacarpophalangeal joint and the second is the proximal interphalangeal joint. The MCP joint connects the fingers to the hand and the proximal interphalangeal joint is a joint which is the mid joint of your finger, and there are about the proximal interphalangeal joint is seen in all finger and the thumb as well. Now this stiffness can be in extension, that means that your finger is stiff and you are not able to bend it, or it can be in flexion, that if your finger is bent and then you are not able to extend it. That is, sometimes your finger is straight, you cannot bend it, sometimes your finger is bent and you cannot straighten it. So all kind of permutations and combination can exist when we talk about stiff fingers, and you can have different grade of stiffness in different fingers. Like you have one finger which is stiff in about 20 degrees, one finger which is stiff in 30 degrees, one finger stiff in 40 degrees in the same hand. So it's like a very complex thing and we need to address it in a very systematic way. Now this stiffness can be due to four reasons. The skin or the fascia can be tight, which is on the superficial layer. The muscle and tendons can be contracted, which can cause stiffness. The stiffness can be because of the capsular and ligamentous structure, and the stiffness can be because of the articular cartilage damage. So these four structures, any of these one or combination of more than one of them can lead to stiffness in your fingers. Now very important thing to understand is about the two joints. The first joint, the metacarpophalangeal joint, is the joint which connects the hand to the fingers, and this joint is a condylar joint. So the movement is the flexion and extension and the sideways movement as well. So it has about 20 degrees of movement in sideways and full movement of flexion and extension. So this is a metacarpophalangeal joint. It is a saddle shaped joint and this is a condylar joint. Now a very important concept is that this joint must be immobilized in flexion. That means whenever you immobilize this joint, this should be the safe position. So let's talk about the safe position of immobilization of the hand. The best position when you want to immobilize your hand is this. So you want to keep your wrist in about 30 degrees of extension. You want to keep the metacarpophalangeal joint, MCP joint, in about 70 degrees to 90 degrees of flexion, but the proximal interphalangeal joint should be completely straight, that is, they should be absolutely in full extension. That is because the MCP joint, if they are stiff in extension, then it is a problem because to achieve flexion in MCP joint is difficult, whereas for the PIP joint it is opposite. To achieve flexion is easy, to achieve extension is difficult. So PIP joint should always be immobilized in extension, fully straight, but the MCP joint should be in about 70 to 90 degrees of flexion. So this makes the safe position of immobilization. If you immobilize in this particular position, the chances of stiffness will be minimum. So hence most of the stiffness in the fingers can be addressed very nicely with a good hand rehabilitation and physiotherapy program. Very occasionally, if there is an extension contracture of the MCP, that means that your MCP joint is absolutely straight and you are not able to bend the fingers, then you can do a surgical release, and for that volar approach is more commonly used as compared to a dorsal approach. If there is a stiffness in PIP joint, you can use a mid-lateral or you can do a percutaneous release as well. The steps include capsulotomy, steps include resection and release of the collateral ligaments and volar plate release as well. So if you do everything, you stand a good chance of improving the range of motion of fingers. Besides this, post-op rehabilitation is very important. We usually use either a dynamic splint or a progressive static splint to increase the post-operative range of motion, because these finger joints are notorious to develop stiffness later on as well. So friends, hope I have able to explain about stiffness of finger in great details. If you have any problem which is related to stiffness in the fingers, you can write down on the comment box as well, and if you want to take an online consultation, you can contact us on the numbers given below. Thanks a lot.